Good afternoon, welcome to the French Tech here in Taipei. I'm Christian Laudet, the founder of AWA, and AWA is working on the hand cleaning system. We deliver antibacterial faucets. Today I want to talk to you about the opportunity of going in France for the health tech business. France is a large country, 60-something million people, and we have about 20% of our population which is over 65. The good news in France is when you get to 65, you have 50% of chance to get to 85. So that creates a big need for the health system. The health system in France is mainly financed by French health insurance, which is run by the governments. It's universal, everybody can get in everywhere on the territory. Our hospitals are mainly public, 60% of them, and then we have 20% which are non-profit and 20% which are for-profit. The biggest challenge that we have in France now in the healthcare industry is to maintain the quality. We are number one in the world according to the WHO for the quality of our healthcare, but at the same time to maintain our costs down. We have a budget which is 3% every year, increase every year, but that does not reflect the number of patients, especially elderly patients, which need more care. So there is a need for improving efficiency and reducing costs in the healthcare industry. The spending in France is huge. We spend 12% of our GDP every year for the healthcare. That's $4,000 for every French person. So no need to say that every saving which can be done is very, very welcome. We started a couple of years ago, 2004 if my memory is good, to introduce a smart card called Carte Vitale, which allowed the patient to go to the doctor and don't have to carry all these medical administration things. So the payments is done through that card, and we can ensure that the doctor will be paid on time. But at this time there is not yet the medical record in the card. That's for privacy concern, which is something French value a lot. So any healthcare program need to be very aware of the data protection and the safety, because people don't want their health data to go to the insurance or anybody, employer or people they don't want to. The main markets on the healthcare device, a connected device, is mainly to support the chronic disease. We think we can cut the cost of the chronic disease if we can do remote follow-up. The doctor can access the data from outside. And today already we have 23% of our chronic patients which are using remote connected device, and that's going to be increasing in the coming years. Of course, we're thinking diabetes, but there is many other diseases like sleep apnea, which are also in this kind of program. And people get paid, reimbursed only if they use the connectivity on the device. There is a very good acceptance from the French doctor on the e-health. We have around 80% of them declare they are very welcoming these things. Why? Because that helps them to spend more time with their patients. Mobile device on experimentation in hospital have led 20% saving on the time, 20% that time that the doctor can spend with the patient. Is even more for the nurses. We have 50% saving on the time spent by the nurse in finding up systems. So any system that we can implement which speed up the work and allow people to do their real medical work is more than welcome. The other side of the equation is we want to avoid people to get sick. So the French government has been promoting a lot of health prevention. You don't get sick, you don't go to the hospital, we save money. And that's also open opportunity for the e-business. Why? Because people want to learn about health. So there is a lot of opportunity in developing access to the knowledge that people can use and develop a better health habit. There is a lot of application possible, device, anything which can help people to get more aware of their health and better manage it is totally welcome in France. The investment in the healthcare business for the tech is big. We have 7 clusters in France which are helping startups. 140 startups, in the health tech, which is the same as the French tech, but for the health sectors. And we are not close to the foreign investment. We have welcomed in 2016 52 major projects from abroad which created jobs in France. There is also cooperation, obviously, in French company working with overseas people to develop their technology. And I believe Taiwan has a big role to play on that, because the strength on the technology in Taiwan will allow the French company to get better quality and hence develop more services with limited cost. And if there is one thing which is really decreasing in France now is the cost of the device. There has been a significant cost cut in France, and that pushed the industrial people to merger and acquisition to get bigger, but it's also pushed them to rethink their industrial model, and hence ODM, OEM in cooperation with Taiwanese companies is something which makes a lot of sense. In conclusion, I will say that France is the 5th biggest market in the world for healthcare. It's very open to innovation. We are looking for that. We are willing to invest with people in innovation. We have one agency which has been set up especially for that, and the main target is to promote the better health before people get sick, and then when they are sick, to make sure they get treated efficiently, at cost efficiently, with a very high quality. And we want to keep them out of the hospital as much as possible. So a big market for the home hospitalization, for the remote medicine and diagnostics. And why we want to keep them out? Saving costs is one, and the other one is protecting them against nosocomial disease. Today in France we have still too much. We are not too bad, but we still have 5% of our people which get in hospital and get out with a new disease. So we fight against that, and the best way is to keep people away from the hospital. It seems strange, but that's actually the truth. The other thing is we are improving our hygiene procedures, and this is where AWA FAUCET is active, because we help people to clean their hand with ozonated water. Because in France we see more and more staff being a little bit reluctant to use the hydrogel, alcoholic gel, which are in use in France. Final conclusion, I will say there is a big chance for the Taiwanese factories and developers. You are good in tech. We have a good market. Don't be afraid to come to France. We can probably do things together. And I'm very confident in the quality and the innovation of Taiwan to serve the interest of the French health.